So, good evening, friends, and welcome to another amazing episode of Crossing Boundaries. I'm sure you're all excited as we have come so far in, moving on and getting out of our comfort zone to help you understand the dental treatment which we give to you and what all other treatment plans you can, see and benefit from. So today our topic is on lasers in dentistry, and I'm going to take you through a presentation as always. And then at the end of the session, we will be able to communicate. So I hope you're all able to see the screen right now. We are at Crossing Boundaries session 8. And my name is Dr. Vidyaa Iyer, and our topic for today's discussion is going to be lasers in dentistry. So many articles in the last few years, especially during the pandemic, has thrown a very great insight into understanding lasers and that how it can be a very innovative tool in the modern dental practice, and what are the different applications of lasers in dentistry. In addition to the use of the lasers, which when I say lasers, I mean both the soft tissue and the hard tissue, which we call it as the diode and the erbium lasers. So the advantage of using those lasers. And we also understand how safe it is and what is the market share and how are people predicting the use of lasers in the coming years. So if you can look at CAGR, which is the compound annual growth rate. So here you will understand a prediction in 2018 that by 2025, you will see a marked rise in the users of lasers. And who are going to be the end users? If you understand, most of the clinics have already started getting into laser dentistry. And this again, as I told you, is a real big jump, especially when you're looking at the different kind of treatment modalities you can use it for. So it is like, you can do more number of treatment and in more number of specialities. So if you look at the specialities in which we can use the lasers, it is, filling industry, wherever we can do root canals, in surgical procedures, in implantology, in peri-implantitis, in periodontics, and in tooth whitening. So you can see that there is a marked increase in the statistics, not only in the treatment plan, but also in each of these inter and intra treatment modalities within a dental practice. So it is up to us to understand the use of technology, and we need to understand that we need to adopt this technology so that we are not left out. And I can just tell you that Dr. Vidyaa Smile Dental Clinic has adopted this technology way back in 2008, and now I can tell you that for the last 13 years we have been working on this particular kind of a super specialty in dentistry. So what is laser? Laser is nothing but a light amplification by the stimulated emission of radiation. Laser is an acronym, and this acronym has thrown light on 5 very important aspects. So when you look at why laser light, we are talking about 3 C's. We say it is monochromatic, it is collateral, and it is coherent. And that is why it is different from an ordinary light. And when you go into a dental clinic, I'm sure your doctor would tell you that you would have to wear some spectacles which are specialized for laser dentistry. So please understand that you're supposed to wear these glasses, and there might be a restriction of people entering the dental room also. So not only that you'll be given a glass, maybe if you're carrying your child into the practice, only the child will be allowed to work be in the workspace, and you might have to sit outside. So please be mindful, especially because you need to understand that the laser light is different from an ordinary light. Now I'm going to show you some clinical cases just to give you an idea why we use lasers and what are the benefits of using lasers. So here is a patient, a young child, and you can see he's got oral ulcers, as we call it, and these ulcers are quite painful. So when you see such patients, you will understand that, you know, these patients have difficulty in eating their food. They will have even difficulty in movement of their lips and even talking at times. So we need to be very careful that we need to give treatment immediately. Most of the times when you go to a doctor, they would say you can have vitamin B, multiple supplements if you say so, and they might give you some topical analgesics wherein there will be a less amount of pain on these areas. So it is very, very, very important for us to understand that we need to give them a kind of an immediate remedy. So what we generally do in our practice is we follow the laser safety protocol. So now I told you about the eyewear. So you can see that this patient is wearing an eyewear. It looks very cool. If you look at it, it looks very, that the patient will really like wearing such things. And when I look at the ulcer in a very close quadrant, you can see that, the entire area is reddened. And what we do is we do a technique called LLLT, or low level laser therapy. So we won't even touch the patient, and then use a non-sharp instrument or a rounded instrument just to check whether the patient is having any pain. And you can see that is an immediate post-op, just to tell you that the patient was comfortable and the redness has reduced dramatically. So these are the advantages of low level laser therapy, which acts inside the cell mitochondria, that is a cell organelle, and it brings out a lot of therapeutic healing capacity for that wounded area. Next, I'm going to show you another case of sensitivity. I'm sure many of you would be experiencing these kind of sensitive teeth, and you might have tried a number of desensitizing pastes. But many a times we don't get the kind of relief which we want to. So this is a study which I have done in my practice and which has been published in the International Journal of Laser Dentistry. And here we have both the diode and the erbium laser, which is the soft and the hard tissue laser. And I have compared it with a market paste which has claimed to be the best. So friends, if you have only an option of desensitizing paste, I understand. However, if you have go to a dentist where they can work on with you with diode and erbium, or diode or erbium laser, then you would see a marked reduction of the sensitivity, thereby saying that lasers have truly given you that kind of an advantage which you are seeking. There's another patient here who has complained of a cheek bite. You can see the reddened area of the inner surface of the cheeks. And here again we use lasers, and you can see that after the first exposure, this is how the patient feels. Now, you must be thinking maybe the redness has come down, but not to a very great extent. But you will be amazed when I show you a 24-hour picture where you'll be able to see that the redness is completely gone. So this is the advantage of using lasers, because, it gives you a kind of LLLT, as I told you, low level laser therapy, where laser actually gets attracted by the chromophores, or these are the pigments which are inside the host tissue or inside you and me, and generally it helps in removal of that by using of a laser tissue interaction. Now, I'm going to show you another case just to help you understand. Many a times after you extract the tooth, your doctor might tell you to have an implant or a bridge, and then, sometimes we just take it lightly. So here is a patient who had extracted a tooth and had a tongue bite. So the lateral border of the tongue, or the side of the tongue as we call it, you can see he's got a blood clot. So now I'm sure the patient will not delay. And what we have done is we have just taken again the laser and done the procedure called low level laser therapy. And this is an immediate post-op picture, and this is a 1 day post-op. So now you can imagine what kind of a relief that patient would have, and now the patient would be ready for any treatment which you say. So this is very important, especially when we try to document cases. I'm sure your dentist must be doing that, and we at Smile Dental Clinic, we work out on all these just because we want to help all patients understand the nuances. So we don't, your identity is kept, well maintained. We don't try to tell the patient's name. Neither we try to show your face. It's only that part of your teeth or your lips or your gums or your cheeks or your tongue where the case is to be noticed. That's where we focus and take pictures. So here is another patient where you can see that, she had a kind of a elevation on her tongue, which helped her, made her feel a little discomfort. And it was not painful though, but she definitely was a little concerned with that extension. And what we did with laser was we just removed that portion. And you can see these are bloodless procedures and no injections are given. And aftercare is very simple, and see within a week's time that area is completely healed. So you don't have to feel embarrassed. At the same time, you're getting a surgical procedure without the basic need of a surgery. So when I say surgical, I definitely mean that, you get a treatment program done. And this program does not mean that you're going to see blood or pain or anything like that. So we use the word surgical only because it is a removal of a tissue from your body. This is another case. This is another publication of mine at the International Journal of Laser Dentistry. And friends, I want to draw a point that here I am the patient. So if you are going to ask me, doctor, will you do it on yourself? So there is something called the VDM rule. Now, what is the VDM rule? It is, will I do it on myself? So it is WIODIOM. So will I do it on myself? So VDM rule. Now this is very important because here I am the patient and I have, I had a mucosal, and this is when you bite your lips, you might have a collection of the saliva, especially in the minor salivary glands, and this is how it will be there. They might cause a kind of interruption when you want to talk, and these are elevated, so you will feel the bump on the exterior. So all we did was take a laser and we cut out the external part, and then we removed that mucosal, and you can see those are my lips, and I just had to do a procedure called tissue welding, where we don't do suturing and we can get our tissue healed. So that is how that lump was, and now you can see after the procedure, and that's the microscopic view of the mucosal. So now if you can understand that when I say it was painless, I really mean it. I didn't have any injections and my aftercare was very simple. So here is another patient where, especially when we are trying to do, say, root canal procedures, there might be an extension of the tissue either from the gums or from the tooth itself, which grows in that area. So with the laser, I can just remove that. Now, what are the post-op instructions which I would be giving to the patient after a laser procedure? Generally, we say you can take an NSAID or non-steroidal anti-inflammatory drugs. It could be any painkiller, if I can make it as simplified for all of you. We also give some vitamin E oil application. It is generally, patients say they never used things like this. The reason is they were very comfortable, and you can give them some cold water to rinse their mouth. You can also ask them to have some ice cream or anything which is going to be cold so that it will help them. And this is very important, my dear friends, because then the rest of the procedure can be really followed with a single sitting. So here the patient had come for a root canal therapy, and we just had to remove that tissue, and then we could see the area better, and then we went ahead with a root canal of that particular particular tooth. And in addition to the root canal, we could use even root canal laser, the kind of irradiation as we call it. So in lasers, in endodontics or in root canal therapy, we use it in 3 different ways. So this is just one of the ways of using the laser. And in terms of extraction, especially in children, so see, many a times when a child comes into a dental office, especially complaining of 2 sets of teeth, the child is more apprehensive. They don't know what to expect. And they might have heard from people saying that, oh, dentistry is painful. So, they also come with that kind of a mindset. So even though as a dentist, we know that the milk teeth is going to fall down, but we don't want to wait for that tooth to fall off, because this would cause a discomfort for the patient, especially while eating with some loose moving teeth. So what you can do is, instead of giving an injection, you can just take your laser and go around that tooth, and we remove the tip and do an LLLT, and you can see that the tooth is extracted. And this particular patient, we just had to tell them to have an ice cream. So imagine, for a child, you are not giving injections, you're just asking them to rinse with cold water and asking them to have an ice cream. So you really become a very cool dentist for the child, and that is very important, especially when the child is actually expecting something worse than this, right? Next is a case of, say, extraction, especially in an elderly patient. And here you can see a sinus tract. When I say a sinus tract, it means that a pus is getting discharged into the oral cavity, and this pus, as it gets discharged, will give the patient a kind of a salty taste in the oral cavity. Now this is very important, because sometimes even after the tooth is debilitated, in the sense that it cannot be saved, it has to be pulled out, patients sometimes say, oh doctor, I don't have pain, I will come back to you when I have an issue. So these kind of delays might cause a lot of pus accumulation in the tooth, because the infection is still there. We say cause is to effect, right? So unless we remove the cause, we will not be able to get a kind of a good solution there. So here we had to give an injection, because we had to extract the tooth. Normal protocols of tooth extraction was followed, and after that we used a laser. Now why a laser in this case? So many a times, if you see that these are bacteria loaded areas. So as a laser dentist, I can say lasers actually are bactericidal, which is that is, they would kill the bacteria, whereas other procedures are bacteriostatic. Now, what is the difference between cidal and static? Cidal means they will kill the bacteria. Now, that is a very big advantage when you go to a laser dentist, and that is what we promote. Now, this is very important, especially because in today's times, where you don't want any secondary infection. You want to go get a teeth removed, and you don't want an infection or a pain or a swelling, or even in times you don't want a second visit to your dentist, right? So this helps you have single sitting procedures, and also reduce the number of medication, especially during the pandemic. And now you can see the healed area, and this is a 24-hour healing mechanism. Next, I'm going to show a case of crown lengthening. Here you will see that the tooth is looking very short. So sometimes what will happen is a tissue can, that is your gums, or what we call as a tissue, would be holding or covering like a curtain over the tooth. So what we generally do is we mark the points on the area where we want the tissue to be cut, and then we slowly remove that tissue. All this while, you can see I have not given any injection, and there is no drop of blood. So this is the advantage of lasers, my dear friends, and you will be able to see a very clean cut And now you can see that the tooth is exposed and now it is ready for clips or orthodontic treatment. So the patient is comfortable because they have had a single sitting procedure. The doctor is comfortable because the patient does not feel any pain. And overall, if you look at it, this is a very stress-free environment. And I'm sure all of us have enough stress in our lives, right? And you would want to have a stress-free environment, especially when you are going to a dentist right now. Another very, very important treatment which we do with lasers is called depigmentation. Now, to understand depigmentation, first let's understand what a pigment is. A pigment is a color which is given on the cheeks or the lips or even the skin by making it dark rather than the lighter version. So the more the pigments, the darker the skin. Now, is this a problem? I would say no, it's not a problem. But today, everybody wants to look good. So when you look at aesthetics, then definitely people are looking at this option. Now, this melanin, as we call, which is a pigment here, this melanin, when seen in excess, when a patient smiles, they don't like that melanin to be shown. And today, with a lot of social media and people wanting to look good, smile good, taking very close pictures of themselves, these are a concern when you look at it. So this patient had a black chocolatey gums, and all we did was we did a procedure called depigmentation. So the pigment was there, and depigmentation means removal of the pigment. And as we remove the pigment, you can see we have done, and this is both the upper and the lower gums, we have done the procedure. And after the procedure, this is how it looks. Now, this is on the day of the procedure, just after the procedure, which we call post-operative picture. Now, just look at a 1 day post-op. So after that, 24 hours later, when we call the patient, this is how you would see. Now, this is a very important picture, my dear friends. I want you to concentrate on this. Here you can see that the gums are a little white or yellowish white. Now, please don't understand this as pus. This is called the laser band-aid, and it is very important for us to educate the patient that you don't have to rub this one. So after 24 hours, you will see this laser band-aid, which is a self-correcting mechanism by the human body. And after 15 days, this is how you would see. Now, when you look at these gums in a very close quarter, you can see that there are a lot of dots in the gums. So the gum, if you look at it, it is basically firm and resilient. Now, how do I compare this? I look at an orange close by, which is an orange rind. And on the orange rind, you will see some spots. Now, those are called spots on the orange. But in our gingiva or in our gums, we call it stippling, which is a natural phenomena. So you can see in 10 to 15 days, this natural phenomena of being firm and resilient, and that is how you see the gums. And here you will see them much clearer. And this is the advantage of getting the procedure done. So you can see that the darkness is reduced, and this causes a lot of self-confidence boost for the patient. And this is completely after the orthodontic treatment and after we have removed that depigmentation. So many a times, especially when patients come to us for complete dentures or full mouth complete dentures, you can see that sometimes the patient does not have enough bone. So what we generally do is we tell you can go in for an implant supported dentures or a complete denture. So here we have done a procedure called vestibuloplasty, where we are increasing the height of the tissue so that we can get a better impression and you will have a better retention of the complete denture. Many a times, many patients would have said, or you might have heard, that my dentures are loose. So this procedure would help the dentures to stay in place. And that is how it is in the upper, and this is how it is in the lower. You can see there's no bleeding, friends. This redness is not bleeding, but it is just that it's an open wound, right? Now I'm using something called a scalpel or a blade to cut that periosteum because I don't want the healing to be jeopardized. And this is a very advantage because what happens is we get a very good understanding of the gums, and we are able to give a much better retention for the patient. So this is very important, and I would encourage you all to understand that this is going to give a very good retention for the patient, and that is very, very important. Right. So now this is immediate post-op, and you can see that's an immediate post-op again of the lower, and this is how the patient heals. Now this is very, very, very important, my dear friends. Now why do I say this? Because till now I used only lasers in the oral cavity, but here I used a scalpel, and now I'm going to show you with a pointer. Can you see this white line there? This is called a scar formation. Now, if I had only a diode laser in my practice, then this is how you will get a scar. And when I have the erbium, the hard tissue laser also, this scar will also not be there. You might say it's only inside my mouth. Who's going to know? We take pride in our work. It's like an autograph which we sign on every patient's mouth, right? And that is why you can see here, absolutely, the healing has been fantastic, and the patient can go ahead with the dentures. You can see that in the upper as against how it was, right? So I'm going to show you a last case before I come out and take your questions. So here you can see this patient had come for an orthodontic treatment. She had spaces. We did a procedure called frenectomy. Now, what is a frenum? You can roll your tongue on the front portion of your upper lip, and you will see a tissue, a fold of tissue there. And that tissue removal is what we are showing right now, which is called frenectomy. And then once we completed the procedure, the patient wanted to have much better looking teeth and gums. So what we did was we did a procedure called depigmentation. We also did a procedure called crown lengthening and gingivoplasty. So when we did, this is how we completed the case on day 1. And you can see 24 hours later, you remember I told you the white and yellowish band-aid or the laser band-aid, that is how you would see it. And this is 15 days later. Remember I told you about the stippling, the gums are getting healed. And this is a 1-year post-op, and this is a 3-year post-op. You can see here the pigments have not come back, and she looks much better. And I'm sure you would understand the kind of smile she would give. So this is very, very important for us, that we restore smiles. We are smile designers, my dear friends. So your smile is something which we take pride in creating, and we at Smile Dental Clinic look into these components of smile. So according to us, smile is an acronym that stands for size and hold in proportion, midline and canting, inclination, which is axial, lip line, which we need to see, extra hard tissue guidelines, and the soft tissue conditions. And this is another publication of mine at the International Journal of Laser Dentistry. And what are the benefits for the patient? I'm sure you are waiting to listen to that, right? So there is no bleeding, minimal injections, better healing, less medication, minimal pain, no discomfort, less time in a dental chair, no sound or anxiety, conserves the surrounding tissues, and we are single sitting procedures. So these are the various benefits which I showed you in the terms of pictures, and I'm sharing it with you in terms of the benefits. So laser dentistry actually helps you get much better results, not only for the patients, but also for the doctor. And this is very important for us to actually understand it. And right now, at this point of time, I'm going to stop sharing my screen. Thank you for being a patient listener, and I'm open to questions. So if you have any questions, you can raise your hands, or you can unmute yourself, and then you can, through the questions. I think I have 10 more minutes, and I'll be taking them. Any questions? Yes, Ramani sir, I think you want to ask something. You have to unmute yourself, sir.
Unmute, yeah. So I am really very happy to listen to the lecture.
Thank you,
It is
sir.
very, very well presented by you. and even a layman can understood. That's a very important thing actually. So it's very good. I mean, all the best.
Thank you so much, sir. Actually, this is Crossing Boundaries session 8. You can actually log into our YouTube channel where we have presented from session 1 to session 7. You can subscribe to our channel and you can look into that. So we have the whole idea or the term called crossing boundaries is we are stepping out of our comfort zone, and you can sit in the comfort of your house and still understand the nuances of dentistry, like what is a filling, why is it we need a crown, what is a root canal treatment. I mean, these are the basic questions which we have put it in a PowerPoint slide, and we are doing this interaction so that most of us get benefited and your questions are answered.
Very much, and you're doing it in an exuberant way, which I like it. Very exuberant. All the best.
Thank you, sir.
I will switch off. Okay. Thank you.
Thank you. Any other questions, friends?
Hi, ma'am.
Hi, Mary.
Ma'am, it's very interesting session. This laser I've heard from my medical college, but yours is very different, very simple, normal person who are not in dental field also can understand. So very informative, very a lot of takeaway. So I also learned something about dentistry today. That's a takeaway I am taking. All the best for your session and all the best for your life also.
Thank you so much, Mary. Thank you so much. I'm so glad it was very simple for all of you to understand, and it was informative too. I think, both needs to be done. So any questions, any other questions? Any other questions? Dr. Anita, do you have any question? Dr. Aishwarya?
No questions, ma'am. It was well explained, ma'am. I didn't know these many uses of lasers before attending this class, but I came to learn a lot about lasers by this class, ma'am. Thank you.
Absolutely. I mean, since you're a doctor, I'm just adding few points here. This presentation was made especially for a patient education, and understanding. But I do something called a laser study club. You can be a part of the club. If you're interested, you just have to text me. I'll add you to that WhatsApp group, and we have a laser tribe where you can be a part of it. Every month, monthly once, I conduct a free webinar only for the dentists who want to learn about lasers and who want to use these lasers into their practice. I also conduct laser courses within my practice, and I can tell you it's a great pride for me because, I have something called skin laser therapy. And I will shortly be showing cases on that too. So I can say I'm the only laser dentist, or I can say the only dentist in India to have that handpiece to do skin, treatment. So it's a great pride for me. And if you're anywhere close by, you can definitely drop into my practice and I can teach you how to use it. You can be a part of the course and you can learn it too, and you can do it for your patients. And today, everybody is concerned about looking the best, right? So this would add up, and I'm, teaching students also that. So it's going to be a great a boost for all the dentists too. So welcome, and you're free to come and visit my practice and learn also.
Thank you, ma'am. Ma'am, great, ma'am. That is like being only one dentist in India. It's such a great thing, ma'am.
Thank you so much. I think hard work and sincerity gets paid, right? So it's a big milestone, and I'm just proud of it. And I feel the entire credit goes to all my patients because they have been such wonderful patrons, and it is such a lovely thing that I can serve them even more better. So I think I should thank my patients and all my patrons. Thank you.
Yeah. Thank you, ma'am. Thank you for the session, ma'am.
Thank you, Aishwarya. Thank you. Dr. Anita, if there is any questions or doubts, feedback, you can do it.
Hi, ma'am.
Hi, Anita.
As usual, it's a wonderful session, ma'am.
Thank you so much.
Actually, I missed the Sunday session, so today I wanted to attend this one. It's a very wonderful and informative session, ma'am. Looking forward to many sessions like this.
Oh, wonderful. Actually, thank you, Anita. Sunday session, the laser study club session, I didn't record it because there was a lot of, interactive sessions. So without permission of other doctors, I can't do that. But this is my forum, so I could do it. I will be having, and if you're part of the tribe, you will get all the information related to the future sessions. And the courses. You just have to ping me or call me. I will give you all the details, and you can tell your friends also. I know you had two of your friends that day, Tasneem and another person. So I'm there to help you all, and together we will take dentistry to another level forward.
Sure, ma'am. Thank you so much. I'll surely tell all my friends, ma'am.
Sure. The laser tribe sessions are going to be free. And all crossing boundary sessions will be free and open to all. So you can definitely tell them. And for the paid sessions, you can let me know.
Sure, ma'am. Thank you.
Thank you so much, Anita. And thank you, friends, and thank you, patrons, for joining in. I look forward for all these sessions, and it is indeed a pleasure for me to present in front of all of you. And I would like to thank each one of you for coming forward and being a part of today's session. Also, as I told you before, you can like, share, subscribe, comment, and press the bell icon so that you can get to see all our sessions. This is available in the YouTube channel, and our YouTube channel is called Team Red Rockstars, Dr. Vidya's Smile Dental Clinic. So it's called Team Red Rockstars, Dr. Vidya's Smile Dental Clinic. And I'm open to questions. So in case you want to interact with me personally, you can. My number is 98401 76088. 98401 76088. So thank you, my dear friends. Have a great evening ahead, and definitely I'll be waiting to talk to you again on another topic next month on crossing boundaries. So till then, take care. Namaste.